Initially, my passion was teaching, and I did apply to the Ministry of Education. And whilst waiting, I got assigned to the Ministry of Finance, miscellaneous section, and I spent 3.5 years there. And during that period, I realized that I wanted to do nursing. So I entered nursing in 1979. I pursued different programs, and even though I did not get into teaching, I'm at a stage where I'm doing a lot of teaching in the health center, in schools, in health promotion programs. So my passion is still being realized, teaching. I came to the ERHA as a trained district health visitor, and I worked at all the different health centers. And then I saw the need for further training, so I returned to UWE and I did the bachelor's in nursing, and particularly specialized in school health because I realized that there was a need there. In the process of doing that, there was key persons who supported me. Of course, my family were always there with me. I have one child, and she was there for me. My husband was there for me as well. In fact, one of my success stories is 34 years of marriage. At San Grande Health Center, I spent 11 months there. My mentor there was District Health Visitor Cynthia Roberts, a dynamic nurse, a nurse who really walked you through the process with her various experiences. I learned a lot under her. And when I had to go up to Toko Health Center, she encouraged me to continue to pursue all the excellence that she would have provided me to have. I did my midwifery training at Port of Spain General Hospital in the year, between the year 1992 and 1994. And I spent a couple years on labor ward and the other ward, but my main ward was postnatal. That was the ward where mother and baby would go after they delivered from the labor ward. So I spent most of my time there, and I really enjoyed working with the mother and baby. You have to make sure as a midwife that as soon as the baby is born, that you bond baby and mother and attach that baby onto the breast. Once you can get that, you find that it should be an easy process further down. Now, there's going to be a problem if you don't do that. First of all, I must say that the nurse in the brown dress is someone who is respected in the community. Now, the part where the district health visitor comes in is that we ought to go and do home visitor follow-up within the first 14 days. That is the critical period where mother is experiencing, and if you're talking about a teenage mother, she's experiencing challenges with breastfeeding. She may be in a home with elderly folks who is encouraging her to use the bottle. So, as district health visitor, we try to get in the home to be able to make sure that baby is breastfeeding, mother feels comfortable about that, and to encourage her. As a district health visitor, you are responsible for your district. And persons in the district, you're dealing with individual, you're dealing with family, you're dealing with the school, you're dealing with groups. Now, when we go to home visit, it's not just that client we go to see. Whoever is in your household that needs any kind of health service care, we assist that person. It could be a grandmother who is diabetic, hypertensive. It could be a young man who probably is on drugs. we make an assessment, we make referrals, all right? So our work is like a jack of all trades, all right? We handle the various issues that we would see, not only in the home, we go to do a home visit, but then remember we are district health visitor, we're dealing with the district as well. So as we go along to do our visit, we observe what is taking place in the community. We have made a video for the preschool children entitled The Adventure of Tina the Turtle. It's a video concerning healthy lifestyle. It touches on topics like good dental practices, healthy eating, exercising, the importance of water, bullying, inappropriate touch, and telling someone concerning anybody who would touch you inappropriately. We have done that because of the challenge that we had previously with the team who would go to the school. Actually, it was a caravan type program where the team will go to the school, dental nurse, health promotion team, nursing, nutritionists. They will go to conduct this caravan-like puppet show, but it was at a cost factor. And we decided to make a change to make it more cost-effective by having a video. And I must say that it has been shown in the preschool. It was well received both by the students, teachers, as well as the parents. So we're in the process now of being able to provide each preschool in the Eastern Regional Health Authority, St. Andrew, St. David, with a copy of the video. Boys have penis, girls have vagina. So if you have a boy, you identify to him that he has a penis and that girls have vagina, all right? And of course, that is a private part, and private part needs to be covered up, and private part should not be touched by anyone. And if anyone touches you there, you need to inform mommy or granny, or if it is in school, your teacher. So I think the drive is on to inform children that their private part is a special part that should be covered up, that should not be touched by anyone, and to inform. That's the thing about it, inform. Because what could happen, the perpetrator will tell them, okay, don't tell. But we are the drive to tell them, tell. Tell mommy, tell daddy, tell teacher, tell whoever. All right? So at least they are informed. In primary school, we have a mandate to go and make sure that we do examination and vaccinate the children for the particular vaccine that the child will need. In secondary school, we here at Eastern Regional Health Authority has established a chronic disease program that focuses on chronic disease risk factors. And we have picked up children who are at risk for diabetes and hypertension. With the extra training in school health, I was able to push the school health program in the secondary school, because as a trained school nurse, you realize that you have the skill to deal with the school, and you see the need. Where we have a concern with the children concerning their exercising, concerning their making the right choices with their eating habit, all right? Concerning drugs and alcohol, all right? So we try as much as possible to educate them concerning making right choices and show them the consequences of wrong choices. A national school health policy established in the health sector. The reason being is because we need the support of a policy to help us to encourage healthy eating in the school population. eating habits, unhealthy eating habits, is the foundation of a lot of chronic disease problems. We have gone in school, whether the dentist or the nutritionist or the health promotion person or the nursing person, and we would have educated the students, we would have educated the parents, and we would have gone in school, and we would have seen all kind of unhealthy snacks, all kind of drinks that full of sugar. And we need to get a policy whereby it can support us, and when we educate our children, we can go in school and know that there's a policy that prevents the sale of unhealthy snacks and encourages not only the student but the parent and the teachers to be able to maintain a healthy life policy where health and nutrition is concerned. For the new nurses who have chosen a profession, I would remind them first of all that they need to take responsibility for their health. They have to make sure that they are healthy physically, spiritually, mentally, socially, as much as they can do, because they are coming into a service where they have to address the health need of the clients or the patients. So that is their first responsibility. I recall as a nurse on a ward, you will enter the ward and you will say good morning. If there's a senior person comes on the ward, you will stand and give that respect to that senior nurse. What has changed is that respect. When you walk into a ward right now, you don't see that taking place. And it's something that we have lost, because our senior persons are the ones who have the experience, are our mentors, and should be given that respect whenever we see them, because they are the ones who are passing on their expertise to us. And we are the ones who are to take it now and pass it on to the younger nurses. So we have lost that as nurses. There's a change concerning attitudes, all right? There's a change concerning how people view each other. But we have the same policy in nursing, all right? We are supposed to have that honesty, that integrity, that respect. And even though it may not be you may not see it in the community, in the classroom, you are reminded of these things. So the nurses are to know that we are a unique profession. And when you put on that dress, whatever color it may be, you have to be a dignified person. We have been working with constraints where short nursing personnel is concerned. And even though you may have a situation where the nurse will complain, most of the time they comply. So I want to highly applaud the nursing personnel, all of them, as well as their light staff, to be able to work as a team so that we can get the job done, which is providing quality care for our clients. So I want to thank them, all of them. We here at Eastern Regional Health Authority, we are concerned concerning promoting the health and wellness of the population, right? We are concerned with motivating the staff, and as much as possible, I know management have sought to do that in terms of sending nurses for training. We are planning in a strategic way to make sure that when we leave, because there's a time and a place for everything. When time to retire, you should retire. But you should make sure that you would have trained your nurses and make sure that they are capable, and we are in the process of doing that.